We'll now look at the intercostal muscles. Now these are tiny little muscles that occur between the ribs. Between each set of ribs, you can see the front part of it, but it actually runs all the way round to the back. It's quite a thin band of muscle. There are two layers. There's a layer that runs this way, and there's a layer that runs almost at 90 degrees to it. These muscles help the ribs to raise up when you breathe in, and as you breathe out, the other layer will help the ribs drop down to help you expel air. So there are muscles of respiration. They may also help very slightly with twisting your whole torso. So as you twist to one side or to the other, the appropriate muscle will contract and it will help this rotation. They're quite vulnerable, and it's not uncommon for the intercostal muscles to go into spasm and set off a trigger point. Trigger points are usually set off by unaccustomed moving. So if you were to twist and stretch and really force something, that may set these triggers off. One of the commoner ways is if you have a bad illness in your chest which sets off a lot of coughing, and you spend, and sometimes you spend a few weeks coughing and coughing, then it will turn on a trigger, and the trigger is somewhere at one of these levels. It may occur at any level, and it may occur anywhere around the space between your ribs. If you set off a trigger, the pain is very local, so it's a tiny little spot of pain, and the pain is usually sharp and stabbing. So quite often you'll go along and see your doctor and say, look, I've been coughing for a long time, I'm tired of this coughing, and every time I cough I get this sharp stabbing pain in my chest. Most times the doctor would examine you and say, ah yes, you have a chest infection, and would then make the diagnosis of, you also have pleurisy. And pleurisy is that the infection has spread to the layer. There's a lovely shiny glistening layer that sits over the lung called the pleura, and if the infection spreads to the pleura, then every time you cough you get a stabbing pain in your chest, and it's very localized. So it's like someone sticks a knife in you. So the doctor would quite legitimately make the diagnosis that there is pleurisy. You'll go on to an antibiotic, and at the end of that you'll still have that sharp stabby pain. And this is actually what you do have, is that you have set off a little localized trigger point in the intercostal muscles.